its new report, Overconfident, How Economic and Health Fault Lines Left the Middle East and North Africa Ill-Prepared to Face COVID-19. The MENA Economic Update for October 2021. This report is a useful examination of the role of public spending and investment in health in the decade running up to the COVID pandemic. The report's findings suggest that the signs of vulnerability in the region's health system performance were visible before the pandemic, but were somewhat masked by strong government authority and a relatively young population. Joining us today to discuss this report are Fareed Belhaj, Vice President of the bank, and Roberta Gatti, Chief Economist for MENA at the bank. Fareed will offer some opening remarks, followed by a presentation of the report by Roberta. Karen Young, Director of the Program on Economics and Energy at MEI, will moderate a conversation following Roberta's presentation. We welcome audience questions in the chat or by email at events@mei.edu, which Karen will be reviewing. Now, let me invite Fareed to make his opening remarks.
Good morning, good afternoon, good evening. Thank you very much, Jerry. Thank you very much, Karen, and all the friends around. It's a pleasure to be here. And it's a great opportunity for us to put on the table this report and to exchange around it. As you know, everything we do in MENA is underpinned by passion. So you would not be surprised with the tone of the report. When we see that something is not going fine, we kind of say it, and say it sometimes in abrupt ways, possibly to make people realize that this region is not tapping into its full potential. Actually, unfortunately, still lagging behind in many issues. And this is why today, having a conversation about a health system that many of us thought that in a number of countries was doing quite all right. And then we were hit by this shock and we understood the reality. We saw, that was a reality check. Countries like Tunisia, like Morocco, like Egypt, like Lebanon, where we really thought that things were kind of under control, fell immediately at the first signs of the shock. So this is why having this conversation today is really important. We are living in a time when health and the economy are more intertwined than ever. As in other regions, obviously, the challenges of MENA faced in responding to the pandemic reflect issues related to a lack of leadership and to the inadequate deployment of modern technologies to identify and contain the spread of the virus. These challenges also reflect the unpreparedness of the region's health system and very poor availability of reliable data. This is really something that is plaguing MENA. Not having data, not only does it touch on the economy, touching on our research, it basically touches on people's lives and the way you can, with relevant data, manage, predict, be able to show leadership and to show that you can actually look at a prospective way of engaging in economic development. And the pandemic has amplified these challenges. And frankly, there's something that I'd like really to stress. Yes, the pandemic had a very strong negative impact on MENA's economies, the social dynamics of MENA. But you know what? All of these challenges were there prior to the pandemic. The pandemic should not be seen as an alibi in any way, shape, or form by the governments. These governments have been lacking leadership for years now. And the pandemic has shown, the incredibly brutal impact on people's lives of this lack of leadership. So this is why we are saying that, the pandemic amplified challenges that were pre-existing. The story of public health system that lacked resilience to adequately meet the needs of citizens is consistent with other trends that are well known to analysts in the region. Many MENA countries entered the pandemic, as I was just saying, with a decade-old history of chronic low growth, macroeconomic imbalances, governance challenges, and deficits again and again in data availability and transparency. So, in a way, how can MENA, the MENA countries, do better in the future? What can be done to prepare for the next pandemic, for the next crisis? And by the way, the next crisis, frankly, is today. Maybe a country that is not necessarily technically in our MENA region of the bank, Sudan, is, as we speak, getting into one of those, again and again coming back, odd governance failures. Today, Sudan is, looking at a possible military coup. And that's not the only country in MENA that is under threat of, going back into, heavy-handed governance. So we need to always be open, have our eyes open on what's going on in MENA, and try to see to what extent we can move forward in broadening our engagement when it comes to governance, to the rule of law, so that citizens have their say on every single issue, including their own health. And this is really what this report is about. As noted in your own MEI recent Thinking MENA Futures report, the region requires bold, creative thinking about its future. We've been saying it forever. We need it. We need to keep saying it. The challenges faced are great today and will continue in the coming decades. Forces of history and of nature impact prospects for the future. And when we say forces of nature, we are looking at climate change. Climate change is a huge, huge issue in MENA. Deforestation, desertification, obviously clean air, the whole over-reliance on fossil fuel. All of this is really hitting a number of our countries economically, and obviously when it comes to the way they are managing their future. So in the decade following what many have jumped and started calling the Arab Spring, which is turning to be less springy than one would have liked it to be, MENA countries did not fundamentally resolve long-standing challenges that showed the region's development progress. As example is the lack of health systems preparedness, which we will discuss obviously today. In the region, if the region is to avoid another lost decade, and a few months ago I wrote a piece, challenging the governments of the region to avoid another lost decade, because I would say that the decade that we just passed was a lost decade. We started with tremendous hopes and tremendous positive outlook, and then we end up today with country after country falling prey to bad governance and terrible economic circumstances. So if the region is to avoid this another lost decade, MENA countries will need to pursue reforms that restore trust, protect human capital, and support jobs and gender equity in a sustainable manner. Gender equity. This is something that we in the Middle East and North Africa region of the bank are stressing again and again. There is absolutely no way that this region will get out of its woes if 50% of the population is not employed, is not given a voice, is not participating in a strong, powerful, affirmative way in the life of the city, in the life of the region. So this is something that we really believe is very, very important. By the way, tomorrow, I believe, we are going to the board of directors with a powerful project in Egypt where the gender dimension is outlined and is stressed. So this is really something that I'd like to put on the table for this discussion and for further discussions with all of you. So through all of these endeavors and in collaboration, obviously, with global and regional partners such as the Middle East Institute, MENA countries are, assured of our continuing support, our continuing attention, and we will not let go of this region. In spite of everything, the Middle East and North Africa region in the bank will always be sitting there raising alarm, sounding alarm bells, raising red flags when things are not going fine, and putting our money where our mouth is. That is wherever we feel that there is a potential for economic development, for transparency, for governance, and for the rule of law. Thank you very, very much, all of you, for organizing this. It's really great to be with you, Jerry, Karen, and all the colleagues, and over to you. Thanks.
Thank you, Fareed, for setting the table for the conversation that's going to follow. And with that, let me hand over to Roberta for her presentation. Thank you.
Thank you, Ambassador. Thank you, Karen. And thank you, Fareed, for this continuous encouragement to not mince words about our diagnostic of what we see, the challenges, but also the opportunities in the region. And we started from the title, Overconfident, which hopefully will become clearer as we go along in the presentation. I just wanted to highlight that this work is the collaborative work together with the Equitable Growth Finance and Institution Group in the bank, with the Health Group in the bank, and with the Research Group in the bank. And you see a long list of authors trying to sort of bridge the macroeconomy and health. Like all semi-annual updates, there are two parts to it. One that looks at the macroeconomic outlook in the next few months, and the other part that looks at a specific topic. And frankly, when we started to think about health, it was difficult to think about anything else. And so what you will see here is an outlook which forecasts the tenuous and uneven economic recovery in 2021, and a deep dive on health systems, which, as Fareed already previewed, have been found both ill-prepared to face such a large shock as the pandemic, and also overconfident vis-a-vis their own capacity. And what we'll do is that we'll present some evidence about the socioeconomic trends that led to this disconnect between the supply of services and the capacity of health systems and the demands on these health systems. And we will conclude on the role of data and transparency, and you'll see how all of these come together. But let me start from the macro outlook. Now, our economists predict that the region will grow by 2.8% for 2021, after having contracted by about 3.8% in 2020. You'll see this depicted in the panel A of this graph in the solid line. And so you can also see that in 2021, the region is forecast to be a little bit below the level of income that it would have had, that it had in 2019. But you can also see in the vertical difference between the dashed black line and the solid line, a large gap between where the region is now in 2021 and where it would have been without the pandemic. This recovery is tenuous, not only because we say, but also if we compare to the sort of worldwide recovery this year, where the predictions are upwards of 5.5% of GDP growth, but it's also uneven. And you see this unevenness across country groups, the Gulf Cooperation Council, the developing oil exporters, the developing oil importers, standards sort of grouping of the region. And you see that only developing MENA, depicted here in blue and orange, are arriving to the level of GDP of 2019. However, if we really want to think about the well-being of people, looking at GDP is not enough. And this is where thinking about GDP per capita becomes really important. And here the picture is really sobering. The same picture that you saw in the previous slide, the black solid line, the dashed black lines are now depicted in terms of per capita. And the region will have a gap between where it is in 2021 and where it was in 2019 of 4.3%. And it had a gap of 6.6% vis-a-vis what it would have been without the pandemic. Again, this recovery plays out differently across different country groups, with probably the largest gap between the counterfactual of no pandemic and the actual growth in the pandemic for the oil importing countries. And we'll see that there is not only differences across country groups, but there are also differences across countries. think about Lebanon, which is now in its fourth year of contraction, and instead Morocco, for example, which rebounded very effectively from the crisis with the per capita growth of about 4%. But Fareed made the case of how intrinsically linked the economy and health are now. And they really are, because health systems not only help save lives, but they also help the recovery to take off. And just to give you a sense, to transition then to health systems of how this interconnectedness even plays out in the data, you see in this graph a relationship between the growth adjustments in growth forecast vis-a-vis the positivity rate in a country. And it turns out that countries with higher positivity rates saw progressively growth downgrades in their forecast, because the forecasters saw a high positivity rate as a proxy for a health system that could not handle the surveillance of the pandemic. But let's now go in order and try to make sense of the statements that we made at the beginning about these socioeconomic trends that shaped the health systems as they are now. Fareed already referred to a lost decade, and the decade that is behind us is a decade where reforms towards a market economy continue to be truncated. As a matter of fact, what we see in MENA is an increase in government expenditure from 2009 and 2019, the only region to do so. Now, you would say in a pandemic that has a large public dimension, maybe this is not so bad. But then it turns out that the spending not only translated into higher public debt, which itself crowded out spending, but was spending that was more invested in a public wage bill, in public employment, which in the social contract of the region has been traditionally connected to maintaining cohesion in countries rather than on public goods. And what you see here on the right-hand side of this slide is depicted the ratio of public health expenditure over the wage bill plotted vis-a-vis the log of GDP. So you see that all the MENA countries depicted in red are below where they would be, supposed to be. And this underinvestment on public health also is specifically about core public health functions. And you see it here, which are preventive health and disease surveillance. Again, for the three countries for which we have this type of spending, the composition, already another signal that often MENA is a data desert rather than a data-rich region. MENA countries are below where we would expect them to be given their level of income. Now, I give you some quick evidence that, if anything, public health in MENA has been over the year underfunded and crowded out by other spending. So that's somehow a measure of the supply. But what is the demand on these systems? We know that MENA is a young region, and this is, don't get me wrong, clearly an asset for the region. The youth of the region comes from a higher than predicted fertility for MENA countries vis-a-vis their levels of income. And in some of the MENA countries in the past decade, there was an increase in fertility, not only just a high level. So you think, okay, well, this is a young region, it must be a healthy region. And prima facie, you see it here. So when you take a measure of the proxy of the health status of the population, such as the death per capita due to non-communicable diseases, heart disease, cancer, and so on, you find that MENA countries, again, depicted in red, are below where they would be supposed to be. So you think, okay, good news. But once you correct for the fact that the MENA region is overwhelmingly young, you find that actually MENA countries do relatively worse than their income comparators, and some of them significantly so. So there is a sense of potentially, we call it here statistical illusion, but there is a sense of a potential high demand for health services in a system that is underfunded. Put the two together, and then you find an overwhelmed health system. And we can get more into details, but the sense was that there weren't sufficient staff, that elective procedures had to be canceled, and so on. Granted, this is not unique to MENA, but something that is very specific to MENA is that, at least according to the data we have, the authorities were not necessarily aware of it. And this is what you see in the next slide. So let me take a minute to tell you what is all this red and all this green that you see. On this left-hand side table, you see 4 indicators that speak to the capacity, the resiliency of a health system, the capacity to do disease surveillance, information sharing across different parts of the system, the capacity to actually expand, sort of redundancy capacity to expand if there is a pandemic, and whether readiness and planning exercises for a pandemic are ever being done. These measures are taken from the Global Health Security Index, which was built in 2019 before the pandemic by a panel of global experts for all the countries in the world through an initiative by Johns Hopkins University and the Economist Intelligence Unit. So what you see here in the table is a lot of red, which means that from a sort of external, as objective as possible assessment, MENA countries are significantly below where you would expect them to be when compared to comparator countries. Now, what you see next through a different exercise from an index that is called SPAR, and SPAR stands for State Party Self-Assessment, which is yearly self-assessment or self-reporting about exactly the same variables: surveillance capacity, information sharing, system capacity, regular planning exercise. What you see here, with a few notable exceptions, is a lot of green. Authorities were over-optimistic vis-a-vis their income comparators of, their ability to conduct disease surveillance, their ability to expand the health system when needed. Take the difference between the two, and you find a measure of the dissonance, of the over-optimism, or as we called it without mincing words, overconfidence of the systems and lack of awareness of the lack of capacity that was engendered by high demand on the system, and a system that was chronically underfunded and a bit forgotten. Now, there are many reasons potentially behind this lack of awareness or this overconfidence. One for sure is the fact that traditionally MENA countries collect fewer data and publish fewer data than other countries. So here we just did a very basic exercise of data density, about 9 indicators that have been used by many countries as just a very basic basic metrics to manage the pandemic. And what we see here is that less than half of the countries can collect some of these basic data, and some collect them and they don't make them public. Collecting more data is important because it can target and shape action to be most effective. Making data public actually helps individuals protect themselves from the virus. And evidence that has been found through mobility data, so the phone mobility data, shows that actually much of the limitation to mobility were not driven by public lockdowns, but in countries where this information was available, was actually driven by private choice. I want to conclude with slides and numbers with something that let me just go back one slide here with slides and numbers. This is the last one. I just wanted to conclude with a further measure of how overwhelmed health systems and data systems were in MENA. So Karlinski and Kobach just published a paper looking at excess mortality across the world, and they were able to collect data for 6 countries in the region. And so excess mortality has become now a sort of proxy for COVID mortality. And they related this excess mortality for a certain period to the officially reported COVID mortality in the country. Taking the ratio, they were able to indicate the countries that were less able or less willing to publish data officially on mortality. And quite astonishingly, that ratio for Egypt is 13. So there is 13 times excess mortality than there is officially reported mortality for COVID. On the other hand, in Tunisia, that ratio is below 1. So that means that through the lockdowns and the limited mobility that happened through the pandemic, actually other types of mortality went down. Now, we talked about a lot of data, but let me just conclude with the main messages that I really would like to discuss with you. I hope that from the evidence that we present, you found some convincing, albeit depressing, evidence that MENA country health systems were ill-prepared to manage the pandemic, but they were also overconfident on the eve of the pandemic about their own capacity. We talked about 3 long-term trends that intersected each other. The first one on the economic side, there has been over the past decade some fiscal myopia. So there has been investment in public employment rather than public goods, which has resulted both in increase in public debt, but over crowded out spending on core public goods such as core health functions. Demographically, this is a region blessed with youth, but statistically, this gives the misguiding impression that this is a healthy population. And it turns out that when we do the right adjustment, this is not the case. So this also speaks to a sort of truncated transition from the economic side towards a market economy. We are not there yet. The presence of the state still looms large. Demographically, still with very high fertility rates, which from the epidemiological point of view mask a population that is less healthy than we would want. Then come COVID, and this was a massive stress test. There are many policy implications. Probably 2 are really worth highlighting. On the spending side, the no regret investment is really strengthening the resilience of health systems for this pandemic, and as Farid said, for the future shocks that will come, be coming from the health side or coming from climate change. The second one is investing in more and better data and in a relationship of openness between the government and citizens. So thank you very much for this opportunity, and I look forward to the conversation. Thank you.
Thank you so much, Roberta. I really learned a lot from this report, and I want to dig down a little bit deeper in some of these findings. But first, I thought I might bring Farid back into the conversation and just talk a little bit about, what the bank has been doing in terms of responses to the pandemic across the MENA region. Farid, maybe you could tell us a little bit about the bank's response.
Yes, no, thank you very much. Look, we have done 3 things. One, when it comes to the mitigating the adverse impact on people's health, we have deployed financing for COVID-related goods and also financing for vaccines. So, for instance, when it comes to say Tunisia, we have delivered $100 million worth of vaccine procurement. Egypt, we have done the same, and we are ready to do anything for any other country. For instance, Lebanon. Lebanon was actually, interestingly enough, in spite of all of the governance issues that they have, Lebanon was the first country in the whole World Bank that benefited from World Bank financing for acquisition of vaccines. And that was already last March, I believe. And you may or may not have heard, at the time, one of the condition we put on the table was a condition of transparency and good governance and equity. So we said, look, there would be no, you may know the word wasta there. And those who deserve to be vaccinated, those who are eligible, will be getting the vaccines. Unfortunately, after a week or 10 days of relative behavior, good behavior, then we started seeing issues. And that's when we put our foot down and we went public. And it was a big deal. A big deal because the public in Lebanon saw that the World Bank was really serious when talking about the need for going about the whole process as agreed, and that there would be no wasta, no intermediaries, nobody would be jumping the queue in a way. And that was good because it really sent a strong message to Lebanon and to other countries in the region. So this is on the health side of things. Then there is another issue because the pandemic, resulted in closures, in businesses falling apart. Hundreds of thousands of small and medium enterprises had to stop their activities. So we have launched a vast program of credit lines for small and medium enterprises, trying to help them, stay afloat until the whole pandemic goes away. I don't know whether it's going to go away at some point, but at least help them mitigate the adverse impact on the economic side. And the third point was, social protection, because we saw in a number of countries, take Lebanon, take Tunisia, and many others, Jordan, Morocco, we saw the level of poverty spiking up very fast, clearly because of all of those SMEs falling apart, and obviously the resulting unemployment that came with it. So we moved on large-scale and ambitious, and I would say affirmative social protection and cash transfer programs that allowed two things. One, for people to get fresh money quickly and to be able to survive, this terrible wave. Second, to allow governments to enter into the much needed reform processes with less social pressure. So it was basically buying oxygen for governments so that whenever there is an opportunity, they would advance some of the reforms that we have been calling for forever. Because as I was saying earlier, yes, the pandemic had a terrible impact on countries, but the pandemic is not an alibi. Those countries were already in a very, very difficult situation because of bad policies and because of lack of governance and transparency. So this is what we have done. And over the last year, I believe, we delivered for MENA an excess of $5.7 or $5.8 billion in financing, both in credits, in grants, and in loans.
Thank you, Fareed. And it's certainly not over. You're right. We're still in this process, and this will be a long road ahead. Roberta, if I could turn to you and sort of dig down a little bit on some of the findings that you shared with us. And for our viewers, the report is available. There's a link in the chat or in the Q&A function, and you can find the report on the World Bank's website and a link from our program page. I do highly recommend reading through it. It's fascinating. One of the findings that I found really surprising was the expense of healthcare, the out-of-pocket expense of healthcare in the MENA region, especially as we know that there's been this expansion in terms of fiscal spending in the decade before the COVID pandemic. But the spending is a bit mismatched. It's more towards public sector wages than into these public good services or health services. So maybe you could describe a little bit, what does that mean, or how does that translate into being underprepared? Where exactly did funds go, and how could they have been directed differently?
Thank you, Karen, for the good question. So first of all, let's get back to the statement that we made that notwithstanding increases in government expenditure, this money didn't go necessarily to health nor to core functions of health. Now, this means that in an underfunded system, a lot of the burden of paying for health ended up being on private individuals. And so if you think in a country like Egypt, 60% of total health spending actually comes out of pockets. In a country like Yemen, 80% of health spending comes out of pocket. On the other hand, in a country like Oman, 6% of total health spending comes out of pocket. There are two big picture elements that are connected to this shift of burden from the public sector to individuals. First of all, there's no risk sharing. So if something happens to me, I need to have, either the saving or being able to keep a job or have a family networks that can help me. And this problem of risk of health spending is so serious that one of the two measures of progress towards universal health coverage is the amount of impoverishing health expenditure that people have to suffer. So in this sense, it's not that there was no spending on health, it's just the responsibility was moved from the state to citizens. The second part is a bit more sort of within the health sort of practice and knowledge, but if you fragment so much the purchasing power of health services, imagining we're a market to citizens, you do not benefit enough of the knowledge and the purchasing power of large purchasers that could be the state vis-a-vis providers. And so not only it's inefficient from the point of view of risk sharing, but it becomes extraordinarily costly. Now, there is one last point that I wanted to make about your question, which was really getting to the core of our study, which is not only we show that there is low spending for public health, but we show that there is low spending on core public health functions, health checkups, immunization, disease surveillance, exactly what ended up being fundamental for the pandemic. And we show it as a percentage of the public wage bill to show that money was spent, but somewhere else. For example, I think that the share of public health expenditure over the wage bill in Saudi Arabia is 0.27, and in a country that's similar in income, Finland, is actually twice as much. So there is a long way to go, and it's a difficult message to pass on now, because now countries are in a moment of restrained fiscal space, and so priorities need to be made. So if I were to say one no regret spending is to spend on core public health functions now.
Well, let's kind of dig down on that a little bit, because as you described, the growth outlook for the region is not very good. We're coming basically in a reverse position of where these countries were before the pandemic in terms of their trajectories of growth. So, how is the pandemic really amplified the gaps within the region? And you can look at that between, energy importers and exporters, or just general kind of, wealth gaps between countries in the region. And, what is that outlook of growth, which you described in your presentation? What does that mean going forward in terms of fiscal space or the ability to direct limited spending to the places where it will make the most impact?
Thank you, Karen. I was trying to mentally parcel out your question, which has many parts. So let me start from the sort of widening gaps on the unevenness of the tenuous recovery. You saw the sort of differences across country groups, oil importers and oil exporters. And clearly the vagaries of oil prices had a massive impact on the region. For sure in 2020 and also in 2021. We just clearly for oil exporters, an increase in oil prices, as we're seeing right now, affects positively their fiscal balance, also their ability to spend more and spend better and respond to the crisis. And it improves their external balance. But it has somehow the opposite impact on oil importers. However, although of opposite sign, the magnitude of these impacts are not the same. So we did some calculations, very simple back of the envelope. But if we look at the growth upgrades from April 21 to September 21, and the increase in oil prices in the same period was about 16% increase, we see that basically, oil is responsible for 0.4 percentage points of growth more for GCC countries, almost the total of our growth upgrade from the April semi-annual to the semi-annual. It is also, this increase in oil prices is also responsible for a drop, a downgrade in oil importing countries, but the magnitude is about 1/3. And this is because the structure of exports of resource-rich countries is very concentrated. If you think about it, like the UAE, 70% of exports of the UAE is oil, while the import structure of oil importing countries is more diffused. So here you see a little bit the sort of unevenness also linked not only to the pandemic, but also to oil prices. There's something that Fareed referred to and that I think is very important, is also the unevenness within countries. And we know that this recession is a recession that affected the poor many orders of magnitude more than the non-poor. Vulnerable groups such as youth, women, informal workers, particularly urban workers, were the ones who were working in a sort of face-to-face contact sectors. They suffer the most from the pandemics. They tend to have low education, which we know from previous crises to be one of the elements that limits the ability of an individual to rebound quickly labor market-wise. So there have been impacts that affected the poor in terms of labor supply, labor income, and also services that are clearly connected with a worsening well-being. And as Fareed was saying, also an increase in poverty. And as a result of the crisis, a conservative estimate is that 30 more million people will be in poverty in 2021. Now, the last part of your question was like, okay, so how do we square it with spending more? I think one quick way to answer would be spending better. And the point that we're trying to make is that spending happened, but it didn't happen on the public good that were absolutely necessary for society to thrive. So that's a first point. A second point is that countries might have, with a rebound in oil prices, which anyway is being forecast for 2022, with oil sort of evening out at $65 per barrel. By end 2022, there will be an improvement in oil exporting countries, developing, and also in their revenue. So we'll see them bouncing back that way. And as a matter of fact, we just saw some recent forecasts for 2022, and actually they're quite optimistic for MENA. My colleagues in the growth group call them a rotation of growth, a sort of reshuffling of who's growing and who's not growing. So that part, I'm quite happy to see. I see it with optimism. At the same time, oil importing countries have debts that are public debt that are so high that spending well and spending on the right thing is absolutely fundamental to avoid problems of lack of sustainability in the future.
And that sustainability would be avoiding a situation that you describe in the report as being overwhelmed, right? So, what does that mean about the health systems as they exist now? And, how might they be, better or changed? And it's not just about, you described this really well, the masking of the health of the population in the region because of its youthful demographic, but, are there certain kinds of illnesses or disease that were masked in that way? Or, how might we describe a health system which is better prepared or not so overwhelmed?
Thank you, Karen. So there are many layers to think about the being overwhelmed. What we try to outline is a disconnect between the funding and the demands, and also disconnect between the understanding of the actual situation of health systems and what we really see. So we looked into various indicators of preparedness and sort of adequacy of health systems. And in general, we see that most countries have a density of skilled health workers that is below what would be predicted by their health, by their income level. And they have a density of facilities also that is below what is predicted by their income level. Notably, a country that is above on both dimensions is Jordan. And this is only one of the few countries that actually was the most pessimistic about itself and probably the most realistic in assessing the ability to respond to a pandemic. So strengthening health systems really means now make them more resilient, investing in core public health functions such as public health surveillance, with testing and information to the public about testing and rolling out the vaccination as rapidly as possible, knowing that we're still learning about the disease. And I'm not an epidemiologist, but we all know about what happened when the Delta variant came about and how there is a different type of effectiveness and of vaccination and so on. So I won't delve into that, but the question is really to strengthen core public health functions and also preventive health. So you were talking about these diseases, that non-communicable diseases, sensitive. What are we talking about? We're talking about diabetes, for example. We're talking about heart conditions. Not only there is a generally lurking high demand for preventive care in the region, but these are the very same comorbidities that make COVID more deadly. So there is a short-term need to address these issues from the preventive side rather than at the end in the curative side, and also a long-term agenda for health systems in MENA that needs attention now and in the long term in a sustained way.
Thank you so much, Roberta. Just for those of you in our audience, if you'd like to ask some questions to Roberta and to the team, you can put those questions into our Q&A, and we'll be compiling them and then responding. I want to give Fareed another chance to join the conversation a bit, and then maybe we'll pepper Roberta again with more questions on the data. But you know, Fareed, we've talked a lot about, you know, where spending could be directed differently or how difficult the recovery might be in terms of allocating resources. But what's the message that the bank is sending with this report and with, you know, what you've learned in the pandemic in terms of, you know, the message to leaders in the region? You know, what is the message in terms of what could be done to be better prepared for the next time we're in a public health crisis or a crisis of another dimension?
Yeah, no, thank you. Let me make 3 points, and I'll get to your specific question. One, I was looking at the chat, and there was a question about a financing that we have made available to Lebanon, $246 million for social safety net. Just to reassure the person who asked the question, the issue is very much on the table. The money has not been withdrawn. As a matter of fact, we had some issues with the Lebanese in terms of the currency that needs to be used for this operation and for the direct financing. And I believe that this is going to be resolved in the coming few days, and hopefully that money will be made available to eligible Lebanese citizens and, by the way, Syrian refugees directly into their hands through a WFP arrangement in the coming few days, hopefully. Another issue that I believe is very relevant to this conversation. You know, a few months ago, we issued another MENA update that had to do with the broad impact of the pandemic on the economy. And at the time, one of the questions was, and I believe that, you know, in your discussion now with Roberta, you alluded to it. You know, there are varieties between the countries: the oil importers, oil exporters, the small countries, large countries, etc. It so happened that, you know, everybody was hit by this. Everybody, those with deep pockets and those with shallow pockets, if I may say. So those oil producers at the time of the pandemic not only were hit with the pandemic, but at that same time, they were hit by oil prices that went down dramatically. And that did not necessarily benefit those oil importers, because there was, you know, trade went down, remittances from those citizens from, you know, oil importing countries that are sitting in the Gulf countries went dried up, and we found a region that was hit equally all through, from, I would say, Morocco all the way to the Gulf countries. Everybody has its share. The only country that actually survived, where the growth kept, positive to a point, was Egypt, for a number of reasons, including, and we need to be really conscious of that, including the fact that Egypt, over the last 4, 5 years, 6 years, went through dramatic economic reforms. Introducing the VAT, floating the currency, moving ahead with reducing subsidies. All of that had a positive impact on the overall macro situation in the country. So just wanted to put that on the table. Third point is, you mentioned health. It's true, and if there is anything that we should recommend to our, to the leaders in MENA, is really to start looking not only at health as a public service, but at all public services. Because health, yes, was hit. But you know what? Over the last very many years, education is hit in a dramatic way. Social protection is in crisis in a large number of countries. So when one looks at, 5, 10, 15 years down the road, if reforms are not taken now, and really dramatic ones, in terms of, broadly speaking, governance of the public sector, more role given to private enterprise, to private entrepreneurship. In the Middle East and North Africa, one of the main findings is that the role of the state in the economy is overwhelming, and it is overwhelming in a very negative way. It's basically stifles any type of creativity, of entrepreneurship, any type of incentive for investments. And this is, if there is one issue that I really would like to push in each one of our engagement with the MENA leaders, it's exactly that. Reduce the role of the state in the economy, instill more governance, more transparency, the rule of law, and get accountability and competitiveness to become part and parcel of the way you lead your economies and lead your countries. Short of that, we will keep doing exactly what we've been doing over the last very, very many years. And frankly, MENA today, is lagging behind in education, lagging behind in health, lagging behind when it comes to regional integration, lagging behind when it comes to the role of the private sector in the economy, transparency and governance. And, when you look at the need for MENA to create jobs, in one of our publications, we said by 2050, the Middle East and North Africa needs to create 300 million jobs for young people, because these are young people who are coming to the job markets, and those jobs will not be created by the public sector. We know that. So there is a need for a qualitative shift in the way our economies are being managed, and this is something that we are putting on the table day in and day out vis-a-vis the leaders of this region. Hopefully, they will listen. We know that many of them do listen. They may not necessarily have the political backbone to push, those reforms, and that's why we are underpinning our conversation with them with strong analytics to strengthen their hands domestically, so they can move ahead with these much-needed reforms. Over to you.
Thanks, Fareed. I mean, this question has come up in the Q&A, and I think it came out very clearly in Roberta's slides and her presentation. The issue of data collection and how you make the argument to governments that this is not just important in terms of transparency, but it has, literally would save lives. It would have a health benefit. And the over or the underestimation of mortality rates, and that the slide that you showed, the difference between Tunisia and Egypt, was incredibly striking. So, the question from the Q&A is, considering that many MENA countries were not interested in collecting health data and may even question the results from this report, how can the bank and its partners convince the region that collecting data on public health matters, and it could actually have a huge impact in government performance? What are you telling your partners?
Yeah, maybe a quick word on that, because at the end of the day, what you need is make sure that decision makers see that something that they are not doing will become a threat to their own position. Look at how the Arab Spring came about. It came about, let's say Tunisia. It came about because for years, the Tunisian government ignored the signals of rising poverty in the country and rising discontent, because they didn't want to see the data. They were not interested in our data. They were just interested in their own doctored data that they would show their leaders or their leader. And at the end of the day, the delta between the reality on the ground and the perceived reality at the government level became so wide that in 1 or 2 or 3 days, the whole regime crumbled. And I believe that this is a very important argument to make. If you want to continue governing in a way that would make it sustainable for you, for yourself, and for your people, you need to look at data and govern on the basis of that data. And that data is to be made available to everybody. You cannot just have it for yourself so that you can play around with it and please whomever is your boss at that particular time. So this is really one of the issues that we are putting on the table in a clear way. And as I said at the beginning, we are trying to, I don't like the concept of speaking truth to power, because I think it's kind of but it's, you talk to people and tell them the reality of things in a non-doctored way, clearly and straight. And you know what, at the end of the day, we are all adults. They know what is good for them. At the same time, our duty is to make sure that that message gets through. This report is one way for us to get that message through to those decision makers.
Roberta, would you like to add to that? What kind of data are we missing?
So there are many ways to look at this problem, and I couldn't be happier to see someone writing in the chat, data save lives, because if an economist like myself who lives on data says something like this, it has a different power. But that's the message that we wanted to convey. Right now, good data save lives. Now, there is evidence in the literature that data is associated with higher GDP growth, that more transparency and data is associated with lower spread on bonds. One thing that I would like to say is that all developed countries share strong, independent statistical offices that publish data and an effective use of data. Data is a resource. It's not something that we should be afraid of. Of course, there might be sort of capacity limitations. Actually, the MENA region is a region that is extraordinarily capable. And if you look at some of the products of some of our statistical offices, they are astonishing in terms of quality. So the barrier to bridge is the sense of comfort that development is a path where we are all experimenting and there's no right answer, there's no silver bullet, but it is through data that we understand whether the adaptive way that we're taking is the one that is likely to take us in a way that is inclusive and sustainable, or whether we are not. We cannot be flying blind. If I may, I would like also to plug one report of the bank that has just been launched and that will be disseminating in our region, which is the World Development Report 2021, Data for Development. And we hope to have many conversations with our counterparts, not only statistical offices, but also in line ministries, about how good use of data, both as collected through surveys or administrative, can really help make the best decision that one can in that moment.
And to sort of close our conversation, we just have a couple of minutes left. I mean, that's really the lesson about being confident with the numbers behind you, right? So you avoid a situation in which you have a sense of false confidence or really lack of clarity. And that's you are being provocative in the title of the report. And what does it mean to choose that sort of language, and who are you sort of positioning that for? Is that lack of resolve, or is that lack of information or funding to that sector? That was a question from the Q&A as well.
This pandemic turned out to be such a complex event in history that not everything is solely about data and it's solely about health system. It is about leadership. It is about ability to respond, ability to finance, and so on. We felt that by focusing on strengthening the resilience of health system and doing something that is very cheap, investing in data, it's very cheap, and being open about data, countries could go a very, very long way. So that was the message. And if through overconfidence, we managed to get some attention to it, we're very glad and looking forward to working together with this great community who has come together today. So thank you on my side, but over to you, Farid.
Well, thank you as well. It's been really great, and hope that this will open the door to many more of these events. Nothing to say, but thanks very much again, and we'll see you very, very soon.
Thank you. Well, it's been our pleasure to host the conversation. We hope to do this again with your forthcoming other work that you're doing. So thank you to the World Bank and to Roberta Gatti and her team for this excellent report, and to Farid for joining us. And you can watch it again, recorded live stream, and you could also access the report from our website or directly from the bank site.